ask you something uncomfortable. How many times in the last month have you walked into a room and completely forgotten why you went there? And when it happened, what did you tell yourself? You probably said what most people say. Oh, that's just normal aging. You maybe even laughed it off. And your doctor, if you mentioned it at all, probably nodded and said the same thing. Normal aging. Nothing to worry about. But here is what no one is telling you. Not every form of forgetting is the same. Not every mental slip carries the same meaning. And the difference between what is normal aging of the brain and what is the brain beginning to accelerate towards something more serious, that difference is measurable. It shows up in patterns, specific, identifiable patterns that most people are walking around with right now, today, completely unaware. And here's what makes this so frustrating. These patterns are not dramatic. They don't announce themselves. They don't show up on a routine blood panel or a quick office visit. They show up in the small, quiet moments of your daily life. And most people, including most doctors in a 12-minute appointment, miss them entirely. I want to ask you to stay with me through this entire video, because near the end, I am going to walk you through something I call the cognitive drift window, a specific, overlooked period of time that brain research has now confirmed is the most critical phase for intervention. Not after symptoms are obvious, during this window. And if you understand it, if you know how to recognize it and respond to it, it could genuinely change the trajectory of how your brain ages. So stay with me. Now, let me tell you what is actually at stake here, because I know why you clicked on this video, and I want to honor that. The deepest fear most of my patients over 60 carry is not death. It is losing themselves before they die. It is sitting in a room full of people they love and not knowing their names. It is needing someone else to manage their money, their medications, their daily schedule. It is the loss of the version of themselves that their family knows and trusts. That is the fear, and it is completely legitimate. After 31 years working as a neurological cardiovascular specialist, the last 22 of them focused specifically on adults over 60, I can tell you this with certainty. The brain does not decline in a straight line. There are tipping points. There are windows. And the people who protect their independence the longest are not necessarily the ones who started with the best genetics. They are the ones who recognized what was happening early enough to do something about it. So today I'm going to give you a specific, actionable framework, not a vague list of eat better and sleep more, a real evidence-based answer to the question of how you know whether your brain is aging at a normal rate or whether something is beginning to accelerate beneath the surface. I'm going to walk you through 7 specific signs that neuroscience has confirmed are markers of accelerated cognitive aging. I will give you the biology behind each one, the research that confirms it, and the concrete action you can take. And I am going to introduce you to something I call the cognitive drift window, a finding that is not widely discussed outside of specialized neurology circles, but that a growing body of research now suggests is the most important 2 to 4 year period in brain aging. Understanding it could genuinely change how you protect yourself. It is coming near the end of the video, and I need you to stay for it. My name is Dr. Mark. I've spent 3 decades trying to give patients the information their 12-minute office visits never had time to deliver. This channel exists because that 12 minutes is not enough. And if what you hear today gives you something genuinely useful, I want to ask you to subscribe right now, not later, now, because every subscriber tells YouTube this content is worth showing to someone else who needs it. Hit that button and let us keep going. Now, here's the problem with the way most people think about brain aging. Most people frame it as a single question. Am I losing my memory? That is it. That is the entire mental model. They test themselves on whether they can remember names, dates, and appointments. And if they can, they conclude that everything is fine. And if they cannot, they panic and assume the worst. Both of those responses are wrong. Because memory is only one of 7 distinct cognitive domains the brain manages, and accelerated aging almost never attacks memory first. It moves quietly through the others, processing speed, executive function, spatial orientation, language retrieval, emotional regulation, sleep architecture, and memory loss, when it finally appears, is often the last sign, not the first. By the time it becomes obvious, the acceleration has already been underway for years. So the better questions are not, do I still remember things? The better questions are these. Am I noticing that it takes longer than it used to for me to process new information? Am I finding it harder to filter out distractions than I did 5 years ago? Am I waking at 3 in the morning more consistently than I used to? And is my sleep feeling less restorative? Am I struggling to find specific words in conversation, not names of people, but common words I've used my whole life? Each of those questions leads to a completely different answer, and each of them corresponds to a different kind of neural change happening inside the brain right now. That is the framework we are going to use today. So let's begin. Let's talk about what is actually happening inside the aging brain, and then go through the 7 signs one by one. Here is the biology. Your brain contains roughly 86 billion neurons, and those neurons communicate through a network of connections called synapses. At the peak of brain function, in your 20s and 30s, your brain was forming and pruning those connections constantly, responding to new input, building new pathways, eliminating ones that were not being used. This is what neuroscientists call neuroplasticity, the brain's ability to reorganize itself. As we age, the rate of that reorganization slows. That is normal. The amount of myelin, the fatty sheath that insulates nerve fibers and speeds up signal transmission, begins to thin in certain regions, particularly the prefrontal cortex and the hippocampus. Think of myelin like the insulation around electrical wiring. When the insulation is thick and intact, signals travel fast and clean. When it thins, signals slow down, they misfire, they lose precision. That is a normal part of aging. Slower, not broken. What is not normal is when that process accelerates. And the evidence now tells us clearly that certain lifestyle exposures, certain inflammatory conditions, and certain patterns of behavior can accelerate myelin thinning by a factor of 2 to 3 times the normal rate. That is not slower. That is the system beginning to break down faster than it should. And these 7 signs are the earliest measurable fingerprints of that acceleration. Sign number 1. You are taking longer to process new information. Not to remember it, to process it in the first place. If you sit down to read something new and it takes you significantly longer than it used to extract meaning from it, not because the content is more complex, but because something feels like it is running slower, that is not a senior moment. That is a signal about processing speed. A 2018 study published in the journal Neurology, following 11,243 adults over age 60 across 12 years, found that a measurable decline in processing speed, defined as a 20% reduction in performance on standardized tasks, preceded a diagnosable cognitive impairment diagnosis by an average of 4.7 years. 4.7 years of warning. Most people miss it entirely. Sign number 2. Your sleep has fragmented. And here is the part nobody talks about. The type of sleep that is disrupting matters enormously. The brain clears its own metabolic waste, including amyloid proteins associated with Alzheimer's disease, during deep, slow-wave sleep. Not during light sleep, not during REM. During deep sleep, stage 3. If you are consistently waking between 2 and 4 in the morning and cannot return to deep sleep, your brain's clearance system is running at reduced capacity. A landmark study out of Washington University School of Medicine, published in Science in 2017, followed 145 cognitively healthy adults and found that those with disrupted slow-wave sleep had 34% higher levels of amyloid beta in their cerebrospinal fluid compared to those with intact sleep architecture. That is not a small difference. That is your brain's waste management system failing on the night shift. Sign number 3. Word retrieval is slowing down. Not names, Words. If you find yourself in the middle of a sentence and a word you have used your entire life, a common, everyday word, simply is not there for a moment, and then it comes back, this is what neurologists call a tip of the tongue phenomenon. An occasional version of this is completely normal. A consistent, progressive increase in how often it happens is not. Research from the Boston University Aphasia Research Center, studying 7,844 adults over 62 across 8 years, found that a 25% increase in tip-of-the-tongue frequency in a 12-month period was significantly correlated with accelerated decline in the language processing networks of the left hemisphere. The brain was not failing to store the word, it was losing rapid access to the retrieval pathway. Sign number 4. You are more easily emotionally dysregulated than you used to be. This one surprises people. If you find yourself more irritable, more anxious, or more emotionally reactive to situations that would not have bothered you as much 20 years ago, and particularly if this irritability has no obvious external cause, this can be a sign of prefrontal cortical thinning. The prefrontal cortex is the brain's regulation center. It is what allows you to pause between stimulus and response. When it thins, that pause shortens. Reactions become faster and less filtered. A 2020 study in JAMA Psychiatry, analyzing neuroimaging data from 9,361 adults between ages 60 and 85, found that prefrontal cortical thinning of 7% or more was associated with a threefold increase in self-reported emotional dysregulation. And critically, that thinning was measurable an average of 5 years before any memory complaint appeared. Sign number 5. You are struggling more than you used to with divided attention. Divided attention is the ability to track two things at once. If you have noticed that you can no longer comfortably hold a conversation while driving in unfamiliar territory, if you have to turn down the radio to navigate, that is divided attention beginning to degrade. This is a function of the executive network, centered in the dorsolateral prefrontal cortex. A 2019 analysis published in Neuropsychology, following 6,102 adults from ages 60 to 79, found that degradation in divided attention tasks was the single most sensitive early biomarker of executive network decline. More sensitive than memory testing, more sensitive than language testing, appearing on average 5.3 years before a formal diagnosis. And I need you to hear this clearly. Sign number 6 is the one that keeps me up at night. Social withdrawal. Not depression, not sadness, just a quiet, almost comfortable pulling back from social engagement. Fewer phone calls, fewer plans made, less interest in being around people. If you or someone you love has begun doing this, and particularly if they rationalize it as finally having peace and quiet, finally having earned the right to stay home, this is one of the most powerful and most overlooked early signals in the literature. A 30-year longitudinal study published in PLOS Medicine following 2,235 adults from midlife into their 80s found that a measurable increase in social isolation between ages 60 and 65 was associated with a 43% higher lifetime risk of developing dementia. Not correlated with, not linked to, predictive of. The researchers proposed two mechanisms: reduced cognitive stimulation from social interaction and elevated inflammatory markers associated with loneliness itself. Both accelerate neural aging. The brain is a social organ. When it begins avoiding its own food source, that is not peace. That is a warning. Sign number 7, changes in your sense of smell. This is the hidden metric. I want you to pay attention to this one because it is not on any checklist most doctors use, and yet the evidence for it is compelling. The olfactory bulb, the brain structure responsible for processing smell, has a direct anatomical connection to the hippocampus, the brain's primary memory structure. And the olfactory bulb is one of the first regions where the cellular changes associated with neurodegenerative disease appear. A 2020 study published in JAMA Neurology, tracking 1,430 older adults over 5 years, found that participants who scored in the lowest 20% on smell identification tests had a 62% higher rate of cognitive decline over the follow-up period than those with intact smell function. If food has begun to taste flatter, if you have stopped noticing the smell of coffee in the morning or rain on the pavement, do not ignore that. Have your sense of smell evaluated. Let me tell you about a patient I'll call Margaret. She was 67 years old, a retired high school English teacher from Baton Rouge, Louisiana. She came to see me not because she was forgetting things. Her memory, she insisted, was fine, but because her daughter had noticed that Margaret had stopped hosting her monthly book club. For 11 years, Margaret had hosted it without missing a single month. And then, over the course of about 18 months, she had quietly, without any stated reason, let it dissolve. Margaret's husband told me she also seemed more irritable in the evenings. She told me food had started tasting blander. She was waking at 3 a.m. most nights and reading until 5. Every one of these things had been explained away individually. Book club was too much work. Stress was making her edgy. The recipes were just getting old. Just a light sleeper now. We ran a comprehensive cognitive panel, a neuroimaging assessment, and a simple smell identification test. Her processing speed had declined by 23% compared to age-matched norms. She had measurable prefrontal cortical thinning. Her olfactory function was in the 22nd percentile. We did not start with medication. We started with targeted sleep intervention, specifically protecting her slow-wave sleep architecture through consistent sleep timing and eliminating the evening screen exposure that was suppressing her melatonin. We reintroduced social engagement through a smaller weekly poetry reading group she agreed to attend. We addressed her inflammatory markers through dietary modification. 6 months later, her processing speed testing had improved by 14%. She was sleeping through to 5 a.m., and she had started a new book club. 8 members. She hosted it herself. Margaret was not losing her mind. She was in a window, and we caught it. And if you've made it this far and you're getting value from this, type the number 3 in the comments right now. Now, let me tell you about the cognitive drift window, because this is what I promised you at the beginning, and it is the piece of this conversation I most need you to understand. Almost nobody outside of specialized aging research talks about this. It does not have a patient-facing name. It does not appear on the pamphlet in your doctor's waiting room. But the evidence for it is now substantial enough that I believe every adult over 60 should know it exists. The cognitive drift window refers to a specific 2 to 4 year period, typically occurring somewhere between ages 62 and 72, during which the brain's compensatory mechanisms, the networks that step in to cover for declining regions, begin to show measurable strain. Here's why this matters. For years, neuroscientists were puzzled by the fact that many people showed significant structural brain changes on imaging, but very few cognitive symptoms. The brain, it turns out, has remarkable redundancy. It reroutes, it compensates, it deploys alternate networks to maintain function even as primary pathways degrade. But this compensation is not infinite, and the research now shows it has a breaking point. A landmark study published in Nature Neuroscience in 2021, analyzing longitudinal neuroimaging data from 4,188 adults over a 12-year period, identified what the researchers called a compensatory collapse threshold, a point at which the backup networks themselves began showing signs of strain. What made this finding remarkable was what it revealed about timing. The window immediately before this threshold, the 2 to 4 years preceding it, was when targeted lifestyle and medical interventions produced the most statistically significant protective outcomes. Not after the threshold, before it. The practical implication of this is this. If you are between 62 and 72, and you are noticing any combination of the 7 signs I described today, even subtly, you may be inside the cognitive drift window right now. And the actions you take in the next 12 to 24 months carry disproportionate weight compared to any other period of your life for protecting your cognitive future. A second patient I want to tell you about briefly. Howard, 71 years old, a retired civil engineer from Spokane, Washington. He came in with a very specific complaint. He had been having trouble with what he called losing his train of thought in the middle of conversations. Not forgetting what was said, losing the thread of where he was going while he was saying it. Executive network strain, classic cognitive drift window presentation. We identified 3 modifiable contributors. Untreated sleep apnea that was fragmenting his deep sleep, elevated homocysteine levels from B12 deficiency, and a near complete absence of aerobic exercise. We addressed all 3 over 4 months. His conversational fluency, measured on follow-up testing, improved to within normal age-matched range. He told me it felt like the fog had lifted. It had. We caught him in the window. Now let me give you the specific mistakes people make that accelerate this process. Because knowing the signs is only half of it. Mistake number 1, relying exclusively on memory testing to assess brain health. Memory is the last domain to decline, not the first. If your doctor's cognitive screening consists entirely of asking you to remember 3 words and draw a clock, they are measuring the trailing edge of a decline that may have been underway for years. Ask specifically for processing speed and executive function assessment. This error alone can account for a diagnostic delay of 3 to 5 years. Mistake number 2, treating sleep disruption as a nuisance rather than a neurological event. Every night of fragmented deep sleep is a night your brain's amyloid clearance system ran at reduced capacity. Over months and years, that accumulates. If you are waking consistently before 4 a.m. and unable to return to deep sleep, this is not something to manage with an over-the-counter antihistamine. It warrants a full sleep study and, if sleep apnea is present, treatment. Untreated sleep apnea is associated with up to an 80% increase in dementia risk across longitudinal studies. 80%. That is not a footnote. That is a headline. Mistake number 3, accepting social withdrawal as earned rest. I understand the appeal. You have spent decades being available to others, but the research on social isolation and cognitive decline is not ambiguous. Chronic social isolation raises inflammatory markers, specifically interleukin-6 and C-reactive protein, at levels that accelerate neural aging in measurable ways. Maintain your social commitments with the same discipline you apply to your medications, because that is what it is. Mistake number 4, ignoring cardiovascular risk factors as a separate issue from brain health. Your brain consumes 20% of your body's total blood supply, while representing only 2% of your body weight. It is the most vascularly demanding organ in the body. Every point of sustained elevation in systolic blood pressure above 140, every decade of poorly controlled blood sugar, narrows and stiffens the vessels feeding the brain. A 2022 meta-analysis in The Lancet, pooling data from 31 studies and 412,000 participants, found that mid to late life hypertension increased dementia risk by 38%. Your heart health and your brain health are not separate departments. They share a building. Mistake number 5, assuming that because you are mentally active, you are adequately protected. Crossword puzzles are not a substitute for cardiovascular exercise. The evidence for aerobic exercise, specifically rhythmic, sustained, heart rate elevating aerobic exercise on brain-derived neurotrophic factor, the protein that stimulates new neural connections, is among the most robust findings in neuroscience. 30 minutes of brisk walking 5 days a week has been shown to increase hippocampal volume by an average of 2% in adults over 60. That is not metaphorical. that is physically measurable. The puzzles are good, but they do not replace movement. Mistake number 6, waiting for a diagnosis before making lifestyle changes. I see this constantly. Patients who say, if something is really wrong, my doctor will catch it. The cognitive drift window doesn't wait for a diagnosis. The compensatory networks don't pause while you're waiting for a referral. The time to act is now, before the threshold, not after. The correct protocol I recommend to every patient over 60 is this. First, get a comprehensive cognitive baseline evaluation that includes processing speed, executive function, divided attention, and language retrieval, not just memory. Request this specifically. Second, get a sleep study if you have any evidence of fragmented sleep. Untreated sleep disorders are among the most modifiable risks we have. Third, know your inflammatory markers, specifically CRP and homocysteine. Elevated homocysteine, often caused by simple B12 and folate deficiency, is directly neurotoxic and completely treatable. Fourth, maintain or build cardiovascular fitness through 30 minutes of aerobic activity at least 5 days per week. Fifth, treat social engagement as a health behavior, not a luxury. Schedule it, protect it. Sixth, have your sense of smell evaluated if you have noticed any change. Ask for a formal olfactory function test. It is available. Most people have never heard of it. Seventh, if you are between 62 and 72, assume you may be in the cognitive drift window and act accordingly. The actions you take in this period carry more weight than they will at any other time. Now let me tell you when to act with urgency rather than methodical response. A gradual, progressive decline in any of the 7 areas I described today is a signal to respond thoughtfully and systematically. It is not a reason to panic. But certain changes represent a different category of urgency. If you experience a sudden, acute change in cognition, confusion that comes on over hours or days rather than months, sudden difficulty with language, sudden disorientation to place or time, or any neurological symptom that appears without a gradual onset, that is not a signal. That is an emergency. Call 911 or go to an emergency room immediately. A sudden change in brain function can represent a transient ischemic attack, a stroke, or a metabolic crisis. These require immediate evaluation. The 7 signs I described today are chronic and progressive. Sudden and dramatic is a different story entirely. Let me bring this together because I want you to leave this video with something concrete. Not just something you heard, but something you can actually use today. The 7 silent signs of accelerated brain aging are slowing in information processing speed, fragmented deep sleep with consistent early waking, increasing tip-of-the-tongue word retrieval failures, increased emotional dysregulation or irritability without clear cause, degrading divided attention, trouble tracking 2 things at once, progressive social withdrawal that feels comfortable but isn't, and changes in your sense of smell, including food tasting flatter or familiar scents becoming absent. Each of these maps to a specific biological mechanism. Each of them precedes memory loss, often by years. None of them show up in a standard office visit unless you specifically ask. And all of them fall within the category of modifiable, responsible, meaningful, if you catch them in time. The cognitive drift window, that 2 to 4 year period before the brain's compensatory networks reach their threshold, is the most important period for intervention that most people never know they are living through. You may be in it now. The time to respond is not after the window closes. So let me ask you directly, do you know your processing speed? Not your memory score, your processing speed. Have you ever had your sense of smell formally evaluated? Have you noticed any of the 7 signs I described today, and have you been explaining them away? Tell me in the comments. Tell me which of these 7 resonated with you. Tell me what you've been explaining away. I read every single one. If you haven't already, please subscribe to this channel. And if this video gave you something useful, hit the like button. It takes 1 second and it helps more adults over 60 find this content when they need it. And share it with your spouse, with your sibling, with your friend who always says, "I'm fine, I'm just getting older." The information that finally makes something click for someone you love may be sitting right here. Brain aging is not a verdict. It is a conversation between your biology and your choices. And now you know the language. I am Dr. Mark. Take care of yourself, because the people who love you are counting on you to be.